Here's a fact that surprises most people. Your kidneys filter around 50 gallons of blood every single day. Not just once, every day. Quietly without complaint, these two fist-sized organs clean your bloodstream, regulate blood pressure, balance fluids, make hormones, and keep you alive. But here's the problem: they don't scream when they're in trouble. You can lose more than 80% of kidney function before a single symptom becomes obvious. That's why kidney toxicity is known as a silent threat. It creeps up over years, sometimes decades, fueled by everyday habits and exposures most of us don't think twice about. What this really means is your body could be quietly drowning in its own waste products while you feel tired, foggy, swollen, or just off. But unless you know what to look for, you won't connect the dots, and the damage will continue until it's too late to reverse. The good news: the body gives off early signs, subtle but real. Your job is to listen before they turn into alarms. And today I'll show you how. We're going to unpack 7 early warning signs that your kidneys may be under toxic stress. Not vague guesses, these are science-backed, clinically observed patterns tied to inflammation, filtration, overload, and tissue damage. And along the way, I'll give you simple, practical tools you can start using immediately. Small behavioral shifts, dietary corrections, hydration protocols, even timing strategies to restore kidney rhythm and lower toxic load. Because this isn't just about avoiding dialysis in your 70s. This is about protecting your clarity, your energy, your sleep, your emotional resilience, your life. So if you felt more bloated than usual, if your skin looks duller, if your urine smells stronger, or if your legs swell by the end of the day, pay attention. These are not random annoyances. They could be whispers from 2 of the most vital, underappreciated organs in your entire body. Let's get into the science, and more importantly, the solutions. You know, the kind of tired that doesn't lift even after 8 hours of sleep, a strong cup of coffee, or a weekend doing nothing? That kind of fatigue isn't normal. It's not laziness, and it's not just aging. Sometimes it sits your kidneys. Here's what the research shows. One of the earliest signs of impaired kidney function is persistent fatigue that's difficult to explain. It doesn't always feel dramatic. It creeps in subtly: less energy in the mornings, difficulty concentrating by afternoon, and a constant sense that you're just running low. Why? Because when your kidneys start to falter, they can't filter metabolic waste efficiently. Urea, creatinine, and other toxins begin to accumulate in your bloodstream. And that affects nearly every system in your body, starting with oxygen delivery. See, healthy kidneys produce a hormone called erythropoietin, or EPO. EPO signals your bone marrow to create red blood cells. Red blood cells are what carry oxygen to your brain and muscles. But when the kidneys are under toxic stress, EPO production drops. Fewer red blood cells means less oxygen gets delivered, and that leads to cellular-level fatigue, mental fog, low stamina, even shortness of breath with mild exertion. It's like trying to run your life on a low battery without knowing the charger's malfunctioning. Now, here's a common mistake. Most people try to solve this fatigue with stimulants. More caffeine, sugar, energy drinks. That might give you a spike, but it doesn't fix the root problem. And over time, those habits may worsen kidney strain by increasing dehydration, blood pressure, and inflammation. So what can you do? A simple tool to apply is this: track your hydration and salt balance for 1 week. Most people either drink too little water or drink too much without enough electrolytes. That creates an imbalance that forces the kidneys to work overtime. Aim for about half your body weight in ounces of water per day, and consider adding a pinch of high-mineral sea salt or an electrolyte tab, especially in the morning. Another protocol? Check your iron and ferritin levels annually, especially if you're over 40. Low iron can compound kidney-related fatigue, and it's often missed. Ask for a full iron panel next time you get labs done. Optimizing iron supports energy, oxygenation, and mitochondrial function. Also worth noting, protein intake matters. If you're on a high-protein diet and starting to feel heavy, foggy, or bloated, you might be overloading your kidneys, especially if you're not balancing it with fiber, hydration, and time-restricted eating. One more question to ask yourself: do you wake up tired no matter how much sleep you get? That might point to underlying kidney strain, especially if it's combined with other symptoms we'll talk about next. Here's the takeaway. If you're feeling persistent fatigue, that doesn't make sense. Don't just push through it. Listen, your body's not being weak, it's asking for help. And the sooner you support kidney function, the faster your energy and mental clarity can return. Have you ever noticed your face looking puffier in the morning than it did the night before? Or that by evening your socks leave deep imprints on your ankles? That kind of swelling isn't just gravity or a salty meal. It could be a sign that your kidneys are struggling. Let's break it down. One of the kidney's core responsibilities is to maintain fluid balance. That means making sure the right amount of water stays in your bloodstream, your cells, and your tissues without pooling where it shouldn't. But when kidney filtration begins to falter, fluid starts leaking into the spaces around your blood vessels. And this is especially noticeable in areas where tissue is soft and loose, like your under eyes, fingers, and ankles. Here's what's happening in your body when this occurs. Your kidneys contain tiny filtration structures called glomeruli. Think of them as ultrafine sieves. When they're healthy, they keep proteins in your bloodstream and remove waste into your urine. But under stress, from high blood pressure, chronic inflammation, or toxic overload, those sieves get damaged. Proteins start leaking into your urine, and when you lose protein, your blood loses the ability to hold water inside your vessels. The result? Water moves into your tissues, causing that visible puffiness. Now, this isn't just about looks, it's a red flag. In fact, a 2022 review in Nature Reviews Nephrology noted that facial and ankle edema is one of the most under-recognized early symptoms of declining renal function, especially in people over 40. Here's a simple tool you can use: the press test. Press your thumb firmly against your shin bone for 5 seconds. If you see an indentation that doesn't bounce back immediately, that's called pitting edema, and it's worth tracking. Another key protocol: reduce hidden sodium intake, especially from processed foods. It's not just about table salt. Bread, canned soups, sauces, and even breakfast cereals can contain more sodium than a bag of chips. High sodium pulls water into the bloodstream, which raises blood pressure and further burdens the kidneys. You don't have to cut salt completely, but balance matters. Aim for potassium-rich foods like avocados, spinach, and sweet potatoes, which help offset sodium's effect and support fluid regulation. And if you're finding this kind of breakdown helpful, consider subscribing. We dive deep into how the brain and body connect and how to use that knowledge to upgrade your health and clarity, one decision at a time. Here's a closing thought for this section. Swelling isn't random. It's not just aging. It's your body sending a message that the fluid regulators, your kidneys, are having trouble keeping up. And noticing it early gives you the power to make changes before damage becomes permanent. Most people don't think twice about their urine. It's just something you flush and forget. But here's the truth. Your urine is a real-time report card from your kidneys. If you want to know how well your body is filtering toxins, start by paying attention to what's in the bowl. The kidneys are constantly filtering your blood, separating out waste, excess water, electrolytes, and small molecules. That filtered fluid becomes urine. So when kidney function begins to shift, the characteristics of your urine change right along with it. Let's look at a few specific warning signs. First, color. Healthy urine should be pale yellow, like straw. Dark yellow or amber usually means you're dehydrated. But if your urine is consistently dark even when you've had plenty of water, it may point to a buildup of waste products that your kidneys aren't clearing efficiently. Then there's odor. Strong-smelling urine, especially if it has a chemical, metallic, or ammonia-like scent, can be a sign of excess urea, a waste product of protein metabolism. If your kidneys aren't clearing urea properly, it gets concentrated and pungent. One study published in BMC Nephrology found that patients with early-stage kidney dysfunction often reported a noticeable shift in urine smell months before they had abnormal blood work. Another flag is frequency. If you're waking up more than once or twice to pee at night, even if you're not drinking late, that can be a sign your kidneys aren't regulating fluid balance effectively. It might also signal a hormonal shift involving antidiuretic hormone ADH, which becomes disrupted when kidney function declines. And here's a big one. Foamy or bubbly urine. This can indicate proteinuria, the leakage of protein into your urine. Normally, proteins like albumin stay in your bloodstream. But when your glomeruli, the tiny filters, are damaged, those proteins sneak through. Foaminess that sticks around after flushing can be a silent but serious red flag. So what can you do about it? First, create a simple urine observation habit. Once a day, maybe your first bathroom trip in the morning, pause for 5 seconds. Ask yourself, is the color too dark? Does it smell off? Are there bubbles? You're not trying to be obsessive. Just observe it. Your body gives feedback. Use it. Second, start supporting your kidneys through hydration timing. Don't just guzzle water randomly. Instead, drink a full glass of water within 30 minutes of waking up. This triggers filtration, supports lymphatic drainage, and helps flush the kidneys after the overnight repair phase. Then drink small amounts throughout the day rather than in large bursts. If you want to go a step further, incorporate naturally diuretic foods like cucumber, celery, lemon, or parsley into your daily meals. These gently stimulate kidney activity without overwhelming the system. And here's a mindset shift to keep in mind: your urine is not waste to ignore. It's communication. If something looks, smells, or behaves differently, your kidneys are trying to get your attention. Listen early, act early, and you might avoid far bigger problems later. We don't usually connect skin issues with kidney problems. If your arms or legs feel dry, your first thought is probably lotion. But what if that dryness isn't a surface issue at all? Here's the thing: when your kidneys are under stress, your skin often becomes the backup detox organ, and the result is chronic dryness, itchiness, or flakiness, even when you're well hydrated and using all the right creams. Let's dig into why. Your kidneys are responsible for clearing out phosphorus, urea, uric acid, and excess minerals. When they can't do that effectively, these waste products accumulate in your blood, and that biochemical imbalance starts to affect your skin. Take phosphorus as an example. When phosphorus builds up, it throws off calcium metabolism and triggers parathyroid hormone (PTH) release. High PTH levels have been linked to skin calcification and persistent itching, especially in the lower legs and back. This is why people with chronic kidney disease often report restless, itchy skin, especially at night when other distractions fade and the signal gets louder. Another cause? Urea retention. Urea is a nitrogen-based waste product. When it's not filtered properly, it diffuses through the skin and alters the pH of your sweat, leading to irritation, rough patches, or a burning itch that moisturizers can't touch. The 2019 study in the Clinical Journal of the American Society of Nephrology highlighted that even early-stage kidney dysfunction can present with non-responsive dermal symptoms, especially when paired with fatigue or subtle swelling. So, how do you respond? First, zoom out from the surface. If your skin feels dry and tight, no matter how much lotion you use, stop assuming it's a skin problem. Start asking, are my internal filters, my kidneys, overloaded? Here's a practical tool. Cut back on phosphorus-heavy processed foods for 2 weeks and see if your skin improves. Look out for additives like phosphate or phosphoric acid. They're common in sodas, deli meats, instant noodles, and shelf-stable baked goods. These hidden phosphorus sources stress the kidneys and can inflame the skin from the inside out. You can also support kidney-skin connection by boosting your sulfur intake through cruciferous vegetables like broccoli, cabbage, or Brussels sprouts. Sulfur helps the liver and kidneys break down waste products more efficiently, reducing the detox burden that spills over into the skin. And if this kind of deep body connection interests you, how your skin, brain, hormones, and organs all talk to each other, you'll want to subscribe. This channel is all about giving you the neuroscience-backed tools to decode those signals and actually do something about them. Remember, when your kidneys get overloaded, the skin often pays the price. Dryness is sometimes a whisper. Itching is a louder knock. If your skin feels irritated from the inside out, don't just reach for cream, look deeper. Your kidneys might be asking for support. Let's talk about something most people ignore: that weird metallic taste in your mouth, or the kind of bad breath that sticks around no matter how much you brush. If this is happening regularly, it's not just poor oral hygiene, it could be your kidneys. When kidney function drops, waste products like urea start to build up in your blood. This condition is called uremia, and it doesn't just affect your internal chemistry, it changes your taste and smell perception. Here's what's happening under the hood. Urea normally gets filtered out by the kidneys and exits the body in your urine. But when your kidneys are stressed, urea builds up in the bloodstream, and that urea eventually gets secreted through your salivary glands. Once it reaches your mouth, an enzyme called urease, made by bacteria on your tongue and gums, breaks it down into ammonia. That's where the metallic or ammonia-like taste comes from. And it's also why your breath might smell sour, bitter, or chemically sharp, even if you've just brushed your teeth. In fact, studies published in Oral Diseases and Nephrology Dialysis Transplantation have shown that over 60% of patients with early-stage kidney dysfunction report some kind of taste disturbance or persistent bad breath well before traditional symptoms show up. Now here's the challenge. Most people assume this is just dehydration, gum disease, or aging. And sure, those factors play a role. But if this taste or odor is persistent, and especially if it's paired with other signs like fatigue, swelling, or skin issues, it may be pointing to a deeper imbalance. So what can you do? A simple protocol is to support your oral microbiome. Your mouth is an extension of your gut, and it plays a critical role in how your body processes and eliminates waste. Start by brushing not just your teeth, but your tongue twice daily. That's where urease-producing bacteria tend to live. Add a tongue scraper if you can. It's a small habit that reduces the breakdown of urea in the mouth. Second, try incorporating chlorophyll-rich foods or supplements like parsley, wheatgrass, or chlorella. These can bind to ammonia and other nitrogenous waste molecules, helping your body neutralize them before they reach the mouth. And here's something overlooked. Digestive timing impacts your oral environment too. Late-night eating gives the kidneys less time to filter and repair. If you regularly eat within 2 hours of bed, try pushing your final meal earlier and let your kidneys rest during sleep. Many people notice fresher breath and better taste within a week. Finally, zoom out. A metallic taste isn't random, it's biochemical. Your body is trying to tell you that something's not being processed efficiently. Pay attention to these smaller signals before they turn into bigger ones. You're lying in bed, just starting to drift off, and then it hits a sudden, sharp cramp in your calf or foot that makes you bolt upright. You stretch, massage, maybe walk it off, but it keeps happening. Some people chalk it up to age. Others blame dehydration or low potassium. But here's what most people miss. Frequent nighttime muscle cramps can be an early sign that your kidneys are under stress. Let's break this down. Your kidneys play a crucial role in regulating electrolyte balance. The levels of sodium, potassium, calcium, magnesium, and phosphorus in your blood. These minerals control the electrical activity of your nerves and muscles. But when kidney function starts to slip, even slightly, that balance starts to shift. It's often subtle. Your blood work might still fall within normal limits, but your neuromuscular system feels the changes first. You might notice twitching, tension, restlessness, or those full-blown middle-of-the-night cramps. Here's what the research shows. Studies in Kidney International and American Journal of Nephrology have linked frequent muscle cramps to early electrolyte imbalances, especially low magnesium and altered calcium phosphate ratios, even in people without full-blown kidney disease. So if you're experiencing cramps multiple nights a week, especially in your legs or feet, your kidneys may not be managing mineral balance the way they should. Let's talk tools. First, a simple strategy. Add magnesium glycinate to your evening routine. Magnesium supports muscle relaxation, nerve signaling, and sleep quality. And glycinate is one of the most bioavailable forms. Start with 200 to 300 milligrams about an hour before bed. Next, check your hydration rhythm, not just quantity. Chugging a liter of water in the afternoon won't help much if you've been underhydrated all morning. Kidney health thrives on steady hydration, especially in the first 4 to 6 hours of your day. Try drinking a glass of water with a pinch of sea salt within 30 minutes of waking. This primes the kidneys and kickstarts mineral absorption. You should also watch out for excessive caffeine or alcohol, which can cause mineral loss and increase urination. If you drink coffee, pair it with a source of potassium, like a banana or half an avocado, to rebalance what's lost. And here's a self-check. Do you feel more cramp prone after long walks, stressful days, or poor sleep? That's a clue your body's recovery systems are compromised, and kidneys play a central role in that recovery loop. Muscle cramps are rarely just about the muscles. They're feedback. Your body is telling you that something isn't getting cleared, absorbed, or regulated properly. When your kidneys can't keep electrolytes in their ideal ranges, your muscles become the alarm system. Let me ask you something. Have you ever had one of those days where you just can't think clearly? You're not sad exactly, but you're not yourself. You can't focus, words feel slower to come, your memory slips, and your mood swings without warning. Now, here's the surprising connection. It might not be your brain's fault. It might be your kidneys. Here's what the science shows. When kidneys aren't functioning well, toxins like urea and creatinine build up in the bloodstream. And these don't just stay in your blood, they pass the blood-brain barrier, altering neurotransmitter levels and disrupting cognitive function. That's why kidney stress can manifest as brain fog, irritability, low motivation, and even symptoms that mimic anxiety or depression. This is known in research as the kidney-brain axis, a communication loop where declining kidney health starts to impair brain function. A 2021 study in Frontiers in Neurology found that even mild kidney impairment was associated with lower executive function, slower processing speed, and increased risk of cognitive decline over time. Why does this happen? Part of the problem is inflammation. When your kidneys aren't filtering properly, inflammatory molecules like cytokines and reactive oxygen species build up, and that systemic inflammation reaches the brain. It affects how your neurons fire, how your hippocampus forms memories, and how dopamine and serotonin are regulated. And then there's the gut-kidney-brain triangle. When toxins from poor digestion or poor filtration build up, your gut microbiome changes. That dysbiosis creates compounds like indoxyl sulfate and p-cresol, which are directly neurotoxic and have been linked to both depression and cognitive impairment. So what can you do to protect your mental clarity? First, consider adding short daily movement right after waking. Even just a brisk 10-minute walk helps clear metabolic waste, stimulate lymph flow, and increase kidney perfusion, which means better filtration and better brain chemistry throughout the day. Second, support your kidneys and brain by lowering dietary toxin load. Cut back on ultra-processed foods, especially those high in additives, preservatives, and artificial sweeteners. These increase the burden on your kidneys and mess with your gut-brain axis. Third, use your mornings for focused work and your evenings for wind down. This supports your natural cortisol rhythm and gives your body predictable cycles to repair, especially important for kidneys, which work harder overnight to process accumulated waste. Finally, ask yourself, is this really just stress or is my body overloaded? If brain fog is showing up consistently, paired with swelling, fatigue, changes in urine or skin, it may not be mental burnout, it may be physiological backup. When your kidneys fall behind, your brain slows down too. And here's the empowering part. Small, consistent habits can reverse that. Your body's filtration system is remarkably responsive, and restoring its balance often brings mental clarity, emotional steadiness, and a greater sense of vitality than you felt in years. So let's step back for a moment. We said just unpack 7 early warning signs that your kidneys may be under toxic stress. That relentless fatigue that sleep can fix, puffiness, or swelling that creeps in by morning or evening. Subtle but telling changes in your urine, its color, smell, or texture. Itchy, dry skin that no moisturizer seems to help. A metallic taste in your mouth or breath that feels off. Muscle cramps that wake you up or derail your evenings. And that frustrating brain fog or mood instability you just can't shake. Individually, these signs might feel small, but stacked together, even 2 or 3 of them, they form a clear pattern. Your body is trying to keep you informed. And your kidneys, being quiet workers by nature, tend to whisper before they scream. Now, here's what I want you to remember. This isn't about fear, it's about awareness. When you start noticing the signals, you start reclaiming control. Because your kidneys aren't just filtration units. They influence your blood pressure, your red blood cell count, your bone health, even your emotional state. When they work well, you feel clear-headed, energetic, and stable. When they're off, even just slightly, the ripple effects touch every system in your body, sometimes in ways that seem completely unrelated at first glance. So what can you do? Start small. Here sits your challenge for the next 48 hours. Pick one of the tools we talked about today and implement it. It could be hydrating more intentionally, especially in the first half of the day. Swapping out processed snacks for whole foods that support mineral balance. Observing your urine for a few seconds each morning instead of ignoring it. Adding magnesium glycinate to your evening routine. Scraping your tongue in the morning to reduce uremic compounds. Going for a short walk after waking up to jumpstart your filtration system. Just pick one. Commit to it. And observe how your body responds. Because once you start listening, really listening, your body becomes a better communicator. You'll catch signals earlier. You'll bounce back faster. And the decisions you make about food, movement, sleep, and stress will begin to align with how your body truly operates. And remember, your kidneys are built for endurance. They've been filtering your blood nonstop since before you were born. They can take a lot, but they respond even better to care, consistency, and early intervention. If this episode helped you decode some of what you've been feeling, or gave you a better lens on how your body works, consider liking the video, subscribing to the channel, and sharing this with someone you care about. That's how we grow this community, not just by consuming information, but by applying it, sharing it, living it. So here's your invitation. Take your health personally, not with stress or fear, but with curiosity, confidence, and the understanding that your body is on your side, always trying to communicate, always working to heal. The kidneys may whisper, but you now know how to listen.